Hey everyone, and welcome to another episode of Healthy Politics, where we're discussing the eternal intersection between healthcare in the United States and American politics. My name is Nick Karls. I'm the Director of Employee Benefits Compliance here at Holmes Murphy, and with me is my esteemed colleague, Den Bishop, a Senior Advisor, basically our guru when it comes to all things healthcare, and especially when it comes to healthcare policy. Say hey, Den.
Hey, Dan. How are you, Nick?
That's a dad joke through and through. My goodness. We're starting
Well,
off strong.
I'm about to be a granddad, so I'm good for the dad jokes.
Oh, I get to listen to my dad drop the dad jokes on my kids all the time, and I love it. I relish it. So best, enjoy it as much as you can. The one big beautiful bill. I mean, the name is an interesting one. I think it's unique in our nation's legislative history, right? It's a different type of title. I had thought that the Democrats forced a name change in the Senate. I think the official name might actually be a little different, but we're going with the OBBB, right? And what's kind of easy for us in some ways, maybe it'll make it a shorter episode, is that essentially what was in the Senate's version was what was passed by the House. There were very few changes at all, really, especially in our area. I don't think there were any changes to the healthcare provisions
Well,
in the
the
bill.
one big omission was the creation of the choice plans, kind of removing the ICRA terminology, providing those incentives. That went away, but other than that, yeah, I agree.
Well, but that was already kicked out in the Senate version, right? So they'd already kicked that out. I was expecting the House to push for a few more things. We did see telehealth make it in. That was cool, right? There were some good provisions, but there wasn't as much horse trading as I expected. But in my world, just straight the things that we're looking at for our clients, and we've sent out materials on it, where you can now have virtual healthcare, telemedicine without impacting your HSA contribution eligibility if you're getting first dollar coverage. Everyone loves that one. Very popular. The direct primary care provision, where you can have direct primary care, where it's providing first dollar coverage, up to $150 for the membership fee or $300 for a family. Again, popular. I think these are great provisions, right? The DCAP one, I think a lot of our clients we're talking to, like, I'm already struggling to pass my non-discrimination testing. Putting it up to 7,500 is not going to do much, but again, it looks and sounds good. Most people aren't going to have an issue with increasing tax exclusions and things like that. So, I mean, ultimately, the provisions that made it through in this kind of limited scope, I'm like, cool, good. But there's more to that story, isn't there, Dan?
Yeah, it's almost what I would say the direct impact is so minimal. The indirect impact, I think, is as big as the direct impact is as small.
Yeah,
Kind of a massive change in Medicaid funding, pretty significant changes to the Affordable Care Act and the marketplace, or Obamacare, whatever we want to call that. I'd like to kind of dive into those, because for our clients on a direct basis, that doesn't impact them. But the indirect basis to kind of what happens in the healthcare economy, what happens in future elections, I think is very significant.
100%. I mean, there's been plenty of articles out there about what we're going to see for renewals in the individual marketplace, right? Especially for the exchange plans. 20% increases is going to be pretty close to the norm. I think it's 20% of the individual plans that are being filed are asking for a 5% or less increase. Everything else, it's 15 to 20%, it seems like.
Yeah. And so the interesting thing is most people don't look at, if you kind of read surveys on participants in Obamacare, those kinds of things, those that are receiving a subsidy, they don't view the cost of healthcare as the total cost that's being paid. They view what they're paying,
Yes.
their piece of it. And the elimination, so kind of what happened is, you go back in the COVID era, with ARRA, the American Recovery Act, and then the Inflation Reduction Act. Both of those things significantly, temporarily increased the subsidies
Yep.
within the marketplace. So people were getting a much bigger subsidy, and it dramatically reduced their cost of insurance. Well, those enhanced subsidies are expiring, and they were not renewed within the one big beautiful bill, which wouldn't expect the Republicans to do that, and they didn't. The What I'm seeing in articles is the estimated impact is about $700 per year per person, just from the expiration of the enhanced subsidies. And most people were paying far less than $100 a month for health insurance once subsidized. So you're going to see people with their coverage more than double what they pay because the subsidies are going away and the prices are going up. That's going to have an impact on kind of opinion of those people of, hey, here comes inflation again in healthcare, at least for the people within Obamacare plans.
Yeah. And we have to remember that for both Medicaid and for the exchange plans and marketplace plans, that there was a decent population that's a part of our workforce, right? They're working for employers, but they're doing part time, or they have a business they're trying to start while they work part time, whatever, and they were relying on those marketplace plans. They were relying on those enhanced subsidies. They were relying on Medicaid to do that. And so as we see that pulled back, both with the marketplace plans or the exchange plans and Medicaid, I do think that our clients, our friends out there, are going to see a change in their employee population and what that workforce is starting to look like and what they're expecting as
Mhm.
we move through 2026, right?
Yeah,
Um,
yeah.
Maybe going back to working for health insurance.
Correct. And I think that would be, if you looked at a Republican platform and kind of things that were inside of this and talk about working, just take that as an example. Within Medicaid, the bill has introduced able-bodied people of working age must either volunteer in the community, be actively working, looking for work. You can't just not be working and receive Medicaid anymore. So that's a real big message politically in terms of Republican Party versus Democratic Party and what they feel about personal responsibility, those kinds of things. But those work requirements that are going in there do fit with the Republican message of, hey, we think maybe people should work just for health insurance if they need to. Democratic positioning has always been, hey, that's job lock. We don't want people to work just for health insurance. We should give them that if they need it. The removal of that in Medicaid is a really big step, and a very consistent political statement by the Republicans on that, that is very much despised by the Democratic side.
Sure.
The work provisions for the administration of it, and the fact that some people are going to lose their Medicaid benefits because they are able and they're working age, able-bodied, not working, not volunteering. They can't have Medicaid anymore.
Yeah, and what's the hourly threshold? Is it at 80 hours?
I think that's it. Yep.
Yeah, they have to be hitting 80 hours to be showing that they're going out and working as much as possible. I
Let
think
me let
this
me
is.
hit
Oh, go ahead, Dad.
let me hit one more thing on the Medicaid side that's there, because the big financial piece in the entire bill really was the reductions in the federal government support of Medicaid. The scoring, the Congressional Budget Office scoring has that almost $1 trillion over 10 years of savings by reduced federal government spending in Medicaid. Some of that was eligibility items. It was the at work provisions. You gotta be working, or it was some of the non-citizen provisions
Yep.
that if you are not a permanent non-citizen who is here legally but not a citizen, you can still get it. But anybody else pretty much has lost access, if you are not a citizen, to Medicaid benefits. So they dealt with the enrollment side of it, but then really dealt with the funding side of it on what I would say are kind of schemes that have happened between hospitals and states to increase federal funding. The Obama administration had previously taken a look at eliminating some of these things. So that one's not a Republican and a Democratic issue. Both sides kind of agreed, hey, wait a minute, this is a game that's being paid.
Yep.
But the federal government is closing those doors, which is going to put more financial responsibility ultimately on states,
Yeah.
and pressure at a hospital level.
When a loophole's been used for decades, It's now part of the system, right? It's I don't know if it's any longer a loophole. It's just part of how you do the funding. And another thing that I kind of just think about is one way or another, if someone needs healthcare, they're going to get it. It's just they're going to show up at an emergency room. Those costs don't go away, right? We have laws and about people having to be seen, about having to be treated. There's medical tourism within the US already where people will go to other states like Minnesota, go get their care and then go back to their state, right? Without necessarily paying their bills. And oftentimes that's getting written off. But anytime you write something off, as we know, that money, it doesn't just disappear, right? That cost remains in the system.
Yeah, and every study that I've seen, almost without regard to its political bias, does agree that the Medicaid provisions and the Obamacare or marketplace provisions, both of those things are going to lead to more people not having insurance. Our uninsured population will almost assuredly increase. The question is kind of how much, but it will, and that will mean more people who are in the healthcare system but don't have any insurance and no way to pay hospitals. Kind of interesting. I took a look at, kind of July 1st when it was, hey, is this going to pass or not? And then signed on the 4th, and what happened in some of the different economic segments of healthcare. And the single biggest area really is Medicaid. So I looked at Centene Corporation, headquartered in Kansas City, very significant player in the Medicaid space, a lot of administrative things inside of that space. Well, their stock price is down 50%.
Yeah.
Because I mean, so you can see what the economy is looking and saying, hey, wait a minute, these cuts in Medicaid financing are going to hurt businesses that are in that. That gets shifted over more pressure on the hospital side of things. So I looked there, and HCA is the largest publicly traded hospital system, and they're down about 10% since then, kind of an immediate, hey, drop. So there was some, so there, but the insurance side of things, because of the Obamacare kind of changes there and some of the Medicaid and the system there. And I looked at Elevance, which is the largest Blue Cross Blue Shield publicly traded company, and it's down 25% almost
Wow.
immediately upon that sign. So you can see what the economic impact in the healthcare industry is. Everybody going, hey, wait, your value's going down. Here's what I worry about for our clients. History tells me that those entities find ways to regain their profitability, their earnings, and they do that. The government doors are shutting on that. And I think this is all the indirect impact that I'm worried about for our clients is that I think the economic pressure to increase prices and increase the volume of services for our clients, that pressure just went up with all of these somewhat unrelated changes, actually put an incredible amount of pressure in the system. The employer-sponsored healthcare system is the pressure release valve economically. And I worry over the next 12 to 18 to 24 months that is going to put even more cost pressure on our clients. And I hate that for them because it's already really, really expensive. But I just think that everyone should go into these next seasons aware of the economic pressures that are coming from these cuts to Obamacare, cuts to Medicaid. They are real.
Yep, I couldn't agree more. We know that we don't script these episodes because that was exactly where I was planning on going, right? Instead of saying a pressure relief valve, I was actually going to say that the employer sponsored plans are the backstop.
Yes.
They're ultimately that backstop of funding, and like I was saying, the money that is lost in the system is not truly lost. They're going to recoup it, and so again, we'll probably be spending the next 4 months digging into the numbers. And when I say we, I mean actually smart people than me that actually know numbers, right?
Yeah.
But trying to figure out what that actual cost impact might look like, trying to do some forecasting, because we'll absolutely be talking to our clients about it because we have to.
Yeah. Yeah. And it's, the good news for our clients is it's not immediate. This is not something they're going to see in this renewal because managed care contracts have multiple year provisions. And so the recontracting and the negotiations that happen, the pressure that comes in that will come 18, 24, 36 months down the line. But I just think our clients should be making decisions now based on how do I pretty aggressively try to improve the cost and quality of the services my people are receiving, because this underlying economic pressure is going to be in the system for the next couple of renewals.
So whether we call it unintended consequences or silver linings, we've talked about those in the past, right? Can you foresee any in this situation? I'm asking you to look in your crystal ball again. I keep on doing this to you. It's kind of becoming a recurring theme as well for us. But can you think of kind of some potential uh, silver linings where perhaps these changes actually bring about something better for the market?
Whew.
I know.
Yeah, no, you know,
Could it could
it's
it
hard to find a silver lining. I do think what this does is the people that end up no longer having insurance, I think in the next presidential campaign, those are going to be the pictures we see and the images, and
sure.
that it has set up for that debate to occur again. And as that debate occurs again, does the market move to come up with better answers to some of our solutions? I hope so. Maybe that's a silver lining. But I do think this sets up for the next presidential debate for healthcare to move right to the top with the changes that are made, that were made, which absolutely are on brand in terms of
Yeah.
Republican and Democratic Party stances on healthcare. Nothing in this is a surprise. These changes are consistent and on brand with where the political parties stand related to healthcare. So,
And my hope is that, one silver lining that we potentially see is that with the transparency provisions that are out there, with that, push for greater transparency, that it forces everyone in the industry to continue to drill down on where are these costs coming from? Where are the inefficiencies? Can this force some greater efficiencies? Can this force us to look at benefits, health insurance in a different way? Where all of a sudden we're starting to cut out some of that waste. We start to cut out some of those things where you look at it and you go, well, that probably wasn't the best way to do it, because we know they exist. That's a big part of our job, right? I mean, whenever we start working with a new client, that we're going through and saying, all right, you're having money go out the door right now, and you're not getting anything for it. Why do we have this in place? Hopefully that this just kind of continues to push that, not just in our industry specifically for employer sponsored group health plans, but throughout the healthcare industry. Uh, Time will tell, right?
time will tell. I mean, bottom line, to kind of go back to where you started, the direct impact on our clients is very small. Couple of positive things in terms of that. The indirect pressure they need to watch out for. But everything is consistent with the Democratic and Republican, consistent with their positions on what they have said they believe regarding healthcare, and this is putting those things into place.
There it is. Well, we are going to take a little bit of a break in our recordings here. Congress ended a little early this year, and they're picking back up in mid-September. So we're going to take a little break ourselves, because if they're not in there making sausage, we don't have much to talk about. But once they get back into the role of legislating, we will pick right back up and see what they're talking about. Maybe there'll be some regulatory changes as well that we can discuss at that time. Otherwise, as everyone knows, it doesn't have to be the end of the conversation. While we're taking those months off, we're actually still doing stuff. So if you want to pick up the phone or send an email, whatever it is, because you want to discuss this stuff further, our colleagues know how to get in touch with us, and we're happy to continue to talk to you about all these interesting developments with the one big beautiful bill. But with that, Den, I appreciate your insight as always, and I hope you have a good rest of your summer.
All right, thanks, Nick.